I believe that the global community has a lot to be proud of. I think when we need to celebrate all the accomplishments that have occurred over the past several decades in terms of being able to scale up HIV care and treatment, scale up HIV prevention. We've made enormous progress when we think about it. Now, more than 18 million people in low and middle income countries have access to treatment, life-saving medications. But we know we have a long way to go to be able to reach control of this epidemic. And we know that what we've done thus far has been very, very successful, and we need to continue doing what we've done thus far. But we also realize and must realize that we need to try new things. We need to identify new innovations. We need to take some of the evidence that we have at hand and take that evidence off the shelf and take it to action. And what I mean by that is that there are often many discoveries that have been made or innovations that have been identified, but they have not really seen the day of light. They have not had the opportunity to be implemented, to be studied, to be researched in the context where they should be needed. And that's very vital at this point in time, that we do the implementation science research to be able to identify how can we scale it up, how can we implement these innovations, and how can we then use them to be able to meet our future targets. There is a gap, and the gap exists between what I call the know and do gap, the knowledge and action gap. And so many different stakeholders have a role to overcome this gap. And for example, policymakers are very vital to be able to adopt some of this evidence and bridge that gap. I think also the funders play a very important role as well to support the implementation of this knowledge into action.